Rural community health centers in Massachusetts are facing financial, accessibility, and staffing issues. And that was true even prior to the new coronavirus and health and safety measures being taken to stop the spread of COVID-19. Telemedicine is one of the ways rural health centers are getting by, but using digital technology in this region can be tricky. I spoke with Eliza Lake, Chief Executive Officer of Hilltown Community Health Center, to learn more.
Obviously, we as a medical, dental, behavioral health, and optometry practice have had to severely curtail the number of services and the types of services that we're able to offer. So as of mid-March, we're only able to offer emergency visits for our dental and optometry patients. And our medical patients are able to come in for sick visits, but we no longer are doing physicals and other sort of routine care besides immunizations for children. Our behavioral health department has been able to transition entirely to telehealth, so we have been able to maintain our volume of visits there. But all of that has had a dramatic effect on our finances. I think health centers across the state are down to about 60% of the volume of revenue that we had prior to COVID-19.
Wow. So that's a big hit. And I think I read in State House News that you talked about the way that community health centers are paid needs to be looked at anyway. It has an impact, the Medicaid payments, as I understand it. Is that because of COVID-19, or was that an issue that you had before COVID-19?
I think that Massachusetts health centers have been struggling financially for a while. We all are at about break even due to the reimbursement we get from sort of the insurance system in general. We're very lucky that we can access funding for our uninsured patients, which is part of our mission and our mandate is that we serve everyone regardless of ability to pay. But it has been difficult to have more than break even for many of us in the state. I think that with the COVID-19 crisis, we've been incredibly grateful to the state and particularly to Mass Health, our state Medicaid program, for allowing us to bill for all of our telehealth visits, including those that are just over the phone. So that has been really tremendous. Without that, this would have been, I can't even imagine how much more devastating than it has been.
And do you anticipate that this type of treatment will continue even after we're back to whatever the new normal is, that this will just be an option, like a tool in your kit available to patients?
That's a term I've been using a lot, is that it will be a tool. It won't be the only one. Obviously, inpatient visits can never go away. There are many, many things that have to be done in person, but it has been incredibly useful. And we certainly urge the state, and we've been talking with all of the policymakers to maintain this level of support for telehealth. Massachusetts has been, I believe, behind other states in supporting that form of reimbursement, and it has been really critical for us over the last 2 months. And I think that patients have really been telling us, not just because of obviously needing to stay home and access, but that they really have found that it works much better than they might have expected. Again, this is a model that's been being used all over the country for many years. So I really hope that we can maintain the access that we have gained through using telehealth.
I know that accessibility for people who, as they get older, becomes a challenge. They might not be driving, and that challenge is exacerbated in rural communities where you don't have access to public transit. Maybe Uber or Lyft comes out to you, but that's a big, big maybe. Can you talk to us about what accessibility looks like for the people that you serve before COVID-19?
Right. So we do not have any public transportation out here in the Hilltowns. And I want to be clear, we also have a site in Amherst. And so obviously that's a different issue there. But up here in the Hilltowns, there's no public transportation. People on Medicaid can get medical transportation for certain kinds of visits in certain situations. And we have had Uber and Lyft come out here with patients, but very rarely. And often there's been an issue with people being dropped off and then having real difficulty getting someone to come take them home after their visit.
And it's expensive.
Yeah, and very expensive, exactly. And so transportation has been a huge issue, and we have done everything we can to support our patients in getting to their visits. But without public transportation, that's been difficult. There's an initiative in Chesterfield through the Community Development Corporation that has been helping with a van. There are a couple other van services through Councils on Aging, but in general, access has been severely limited by transportation. So telehealth has certainly provided a way for people who have no transportation to be able to have that relationship with their provider in a way that wasn't accessible before.
You talked about sometimes this is telephone. I imagine some of these are also video conferencing visits. I know that you're joining us via your office because, as you explained to me, the internet at your home office is incredibly unreliable. Another huge challenge we have in the Hilltowns, people in the eastern part of the state are still shocked to hear that there are communities in western Massachusetts that have no internet service or have very little and it's intermittent. How has that impacted your ability to serve people via telehealth?
So there are communities that do have broadband, obviously, or cable, high speed, but there are many that don't. And there's been a huge initiative, as I'm sure everyone knows, over the last few years to make that happen. And unfortunately, this happened about a year earlier. If it had happened a year later, I guess I should say, then this might be less of an issue. But even in places where there is broadband, and I hear this from my colleagues across the state, there are plenty of people who cannot afford to have broadband at home. And even if they have phones, they may have flip phones, they may have phones that they are putting minutes on. We definitely have patients who are saying that, an hour therapy session has been a lifesaver, but they don't have the minutes on their phone to be able to do it consistently. And so we're working very hard to make sure that that is not a barrier. So I think, and I want to say that I know the state has also worked very hard to make sure that there are high-speed hotspots in the communities where there isn't broadband in people's homes. But again, that requires people to go and sit in their car outside of the school or other public place to do their healthcare visits. So it's not ideal, but it is obviously better than nothing at all.
Yeah, and sometimes libraries fill that gap for people. You can check out a hotspot, but libraries are closed right now because of the pandemic. So yet another challenge that presents itself. I was also thinking for our own family, we had a telehealth visit for my son. He was fine. But for me as a parent, I was a little reluctant. I like the assurity of the doctor looking in his little ears and saying, no, he definitely doesn't have an ear infection. Have you had that challenge too with your patients, either in them not really trusting it as much as maybe a hands-on visit, or for people who just aren't comfortable with the technology piece?
I think you'll see both of that. I mean, right now it's a little hard to judge because a lot of people aren't wanting to interact with the healthcare system in person because of their fear of the infection. Although I would say, and I'll take any chance I can, the healthcare system right now is very prepared to serve people for emergencies and for visits that cannot be put off, and that people should absolutely call for care and let their PCP determine whether or not they need an in-person visit to maintain their safety. So just want to make that point. But I think that it will be interesting to see as we all transition into a new phase, how much people really want to stay with telehealth. I think for some visits, it works incredibly well. And then how many want to maintain that, personal contact with the providers, which the providers, I mean, that's why they became, nurse practitioners or doctors or dentists, behavioral health providers is for that one-on-one, human contact. So I think it's missed on both sides, but I think that telehealth is critically important going forward.
Governor Charlie Baker, as you know, came out with his phased reopening plan this week. What does reopening look like for you as a community health center?
So community health centers, we have not closed, and we've been providing care all along. So we are included in phase one, and there have been some changes in terms of what kinds of services we can provide, but most of those we've been doing all along. And so we are, got guidance on the preparations that we need to do, the protocols we need to have in place to meet the governor's guidance, and we got those on Monday and are working very hard to meet those. I think the rest of the primary care, rest of primary care in the state can open on the 25th. But I think all of us are really keeping top of mind the safety of our patients and the safety of our staff. We feel that moving forward into reopening may cause as many, but real challenges in terms of staff safety, particularly in areas like dental, where it is impossible for someone to wear a mask while they're getting dental care. And there are a lot of procedures that involve aerosolization of saliva. And so we are working very hard to ensure that we have all the PPE, all of the air filtration, all of the systems in place to make sure that that is safe for both patients and staff.